Hello and welcome to the Seizures class. In this presentation, I will share information with you that will be beneficial as you work with people we support who may have epilepsy or experience seizures. The chapters covered in this module include recognizing seizures, observing, reporting, and assisting, diagnosis and treatment, and assisting with individual adjustment. Staff are responsible for providing accurate observation and documentation of seizure activity. Consistency and accuracy with observation and documentation is extremely important since it helps the medical team with diagnosing the correct type of seizure a person may be experiencing, as well as the best medications to prescribe. Once you complete this module, you should be able to recognize seizure activity, know how to accurately document seizure activity, know how to assist a person during and after having a seizure, be able to assist with medical visits, help people we support in following their medication schedules, and know how to observe for medication side effects. Additionally, you will learn strategies on how you can assist people we support in adjusting to having seizures, as well as knowing how to recognize and modify any environmental factors that lead to seizure activity in people we support. Oftentimes, when people think about seizures, they envision seizure activity that is typically depicted in movies or on TV that includes dramatic behaviors like falling to the floor, loss of consciousness, convulsions, foaming at the mouth, and biting of the tongue. However, the majority of seizures do not involve those dramatic behaviors. Seizures actually take on many different forms. There are over 20 forms of seizure activity, and some seizures may be difficult to distinguish from ordinary daily activities because the behaviors might be common or may not seem out of the ordinary. That becomes particularly challenging for an accurate seizure diagnosis, which is why it is vital that staff know how to accurately observe and document behaviors that occur prior to, during, and after a seizure for people we support. There are some common terms associated with seizures that I will regularly refer to throughout the presentation, all of which I have actually already used. A seizure is an uncontrollable discharge of brain cells and a symptom of disturbed brain function. As I mentioned earlier, there are many types of seizures and behaviors associated with the different types. Epilepsy is a tendency to have recurring seizures and usually results from a disorder of the central nervous system. A convulsion is a term used to describe the muscular contraction and jerking movements associated with tonic-clonic, which used to be referred to as grand mal seizures. Although people with epilepsy have a regular seizure activity, a person does not need to be diagnosed with epilepsy to have a seizure. In fact, 1 in 11 people experience a seizure at some point in their life. Under the right circumstances, anyone can have a seizure. Common causes of seizures in people without epilepsy include head injuries. Epilepsy is typically diagnosed before the age range of approximately 18 to 21 years of age. Occurrence of an epilepsy diagnosis in an older person is generally the result of a stroke or a tumor. There are many different factors that can lead to seizure activity in epilepsy. Genetics is a common cause. If someone has one parent with epilepsy, their risk for developing epilepsy is 6%. If both parents have epilepsy, the risk increases to 12%. Problems during pregnancy or delivery can lead to seizure activity. These gestational, perinatal, or neonatal complications might include a problem during fetal development or a lack of oxygen during childbirth. They might also include any trauma the mother may have experienced during pregnancy, such as a car accident or injury to her abdominal area. Infections such as meningitis or encephalitis can cause epilepsy. Accidents, especially those involving injury to the head, such as car and motorcycle accidents, or contact sports such as football, hockey, or any activity where a person's head is prone to injury, can cause epilepsy. Brain tumors and vascular issues like strokes or problems with the circulatory system can also cause epilepsy. Low blood sugar or other alterations in blood sugar, including vitamin deficiencies, dehydration, or an imbalance of minerals, can cause epilepsy or seizure activity. And degenerative diseases like Alzheimer's disease can also cause epilepsy. Epilepsy takes on many forms and has many causes. When considering some of the causes of epilepsy, there are also things that can be done proactively to help prevent epilepsy. It's important to wear protective headgear like helmets when engaging in contact sports, riding motorcycles, bicycles, or taking part in any activity where the head is at risk of being injured. Always wear a seatbelt when driving or riding in a car. Limit the use of illicit drugs or alcohol. If pregnant, seek out good prenatal care. Eat a balanced diet. Stay on top of vaccinations and regular checkups. And if you have epilepsy, it's beneficial to receive genetic counseling. When working with people we support, it is the staff's responsibility to recognize, observe, document, and assist a person during a seizure, and to also modify the environmental factors that cause seizures. The following video provides information regarding seizures and epilepsy.
Having a brain seizure can be a terrifying experience. If you have a seizure more than once, you may have epilepsy, a problem with electrical activity in your brain. So what causes epilepsy? For most people, the brain sends electrical signals throughout the body efficiently in a coordinated way. In epilepsy, however, the normal pattern of electrical activity becomes disturbed. This causes the brain to be too excitable or jumpy, and it sends out abnormal signals. The result is repeated seizures that could happen at any time. Epilepsy seizures usually begin between ages of 5 and 20, but they can happen at any age. Common causes include stroke, or a mini stroke called transient ischemic attack, dementia, or loss of brain function such as Alzheimer's disease, traumatic brain injury, infections in the brain problems you're born with, or perhaps a brain tumor. Some people with epilepsy may have simple staring spells, while on the other end of the spectrum, others have violent, uncontrollable shaking and loss of consciousness. Before each seizure, some people have strange sensations, such as tingling, smelling an odor that isn't really there, or emotional changes. This is called an aura. Your doctor will perform a number of tests to find out if epilepsy is causing your seizures. One test, an electroencephalogram or EEG, checks your brain's electrical activity. Other tests can take detailed pictures of the part of your brain that's causing your seizures. Your doctor will most likely start treating your epilepsy with medication. These medicines, called anticonvulsants, may reduce the number of seizures you have in the future. Sometimes, changing the diet of a child with epilepsy can help prevent seizures. Your doctor will probably talk to you about making some changes in your life, such as reducing your stress, getting more sleep, and avoiding alcohol and certain recreational drugs. Surgery to remove a brain tumor or abnormal blood vessels or brain cells may make the seizures stop. Another surgery can place a vagus nerve stimulator in your brain. This device is like a pacemaker for your brain that can limit the number of seizures you have. For many people, epilepsy is a lifelong problem, and they'll always need to take anti-seizure medicines. There is a very low risk of sudden death with epilepsy. However, you or someone else can be seriously injured if you have a seizure while driving or operating equipment. If your seizures are uncontrolled, you should not drive.
As the video stated, there are many types of seizures and seizure activity. Some behaviors are not much different from behaviors we see every day, which makes diagnosis of epilepsy and seizure activity particularly challenging. Some of those behaviors may be pulling at clothes, lip smacking, or a loud outburst or temper tantrum. People who have multiple disabilities are more likely to have several types of seizure patterns and behaviors. As people age, seizure patterns change over time and change more rapidly in children. Seizures are typically not considered emergencies, especially with people who have already been diagnosed with seizure activity or epilepsy. But there are times when seizures are considered serious and need medical attention. When working with people we support, it is not your responsibility to diagnose a seizure, but you are responsible for recognizing a seizure and seizure behavior and accurately documenting and reporting it. As the video stated, some people experience auras prior to their seizures. An aura is an early sensation of some types of seizures and can last anywhere from a few seconds to a few days. Recognizing and documenting auras helps the doctor with correctly determining where a seizure originates in the brain, diagnosing the type of seizure, and prescribing appropriate medications. Some examples of auras are a strange sensation or pain in the abdomen, a strange feeling all over the body. The person says they feel different or they act different, but they can't describe the sensation. Tingling, numbness, or pain in various parts of the body. A headache. Sensations of movement in the arms, legs, or extremities, but they aren't actually moving. Changes in vision, like seeing spots or colors before the eyes. Any other vision issues. Hearing sounds of musical patterns. Dizzy spells. Smelling or tasting things that aren't actually there. And feelings of deja vu. Seizures are divided into two types: partial seizures and generalized seizures. Partial seizures consist of simple partial and complex partial seizures. Generalized seizures consist of tonic-clonic, absence, myoclonic, and atonic seizures. We will overview them all. Simple partial seizures originate in a specific part of the brain and affect specific body functions and movements like speech, the senses, or the muscles. Some behaviors of simple partial seizures may be shaking limbs, burning or prickling sensations, and smelling things that aren't there. There is no loss of consciousness with simple partial seizures, and they may generalize. Generalize refers to when one type of seizure develops into a different type of seizure. In this case, a simple partial seizure would generalize into a tonic-clonic seizure, and there would be loss of consciousness. Complex partial seizures are commonly mistaken for behavioral problems or mental illness because of the nature of the behaviors associated with them. Complex partial seizures commonly originate in the temporal lobes and are seen mostly in adults, but sometimes in children. They almost always include an aura and usually only last a few minutes. The person usually does not remember the seizure. The type of behavior that might be seen with a complex partial seizure might be the person seems to be in a sleepwalking or dreaming state. They might display chewing or smacking movements of the mouth. They may stare blankly. They may mumble or speak incoherently. They may rub their hands together, and they may wander or run. It is very important to respond by following the person from place to place, move hazards out of the way, and direct the person away from hazards. The following video shows what a complex partial seizure might look like and the appropriate way to respond.
You can see in looking at the chart, we're looking at least a 10% increase from our first quarter to our second.
Adam? You're okay, Adam. You're fine, you're okay.
What's going on?
He's having a seizure. It'll pass. It's okay. You're okay.
Do you need help? Do you need me to call 911?
No, it's not an emergency. You're okay, Adam. You're okay. Do you mind pushing back the chair, please? Thank you. You're fine.
It happened again?
You just had a seizure.
You need to sit down for a minute. Guys, this happens to me sometimes. I have epilepsy. This happens to me sometimes. Just bear with me for a couple of minutes.
There are 4 types of generalized seizures: tonic-clonic, absence, myoclonic, and atonic. Generalized seizures affect the entire brain. Tonic-clonic seizures are the most well-known type of seizure because they are the most dramatic. Tonic-clonic seizures typically have no aura unless they generalize from a type of seizure that does have an aura, like a simple partial seizure. As the seizure starts, the person's chest tightens, which might cause them to yell or cry. During the tonic phase, which is about 10 to 30 seconds, the body becomes rigid, the back arches, the limbs extend, and then the person experiences convulsions for 1 to 5 minutes. The person's breathing may also be irregular or labored, and they may lose bowel and/or bladder control. They might bite their tongue, but it's important not to put anything in the person's mouth to stop that, since it might cause them to break a tooth or choke. It's common for the person to sleep deeply following a tonic-clonic seizure, and when they wake up, they might be confused, have slurred speech, and may have a headache. It is important to speak to the person calmly and explain to them that they just had a seizure. It is also very important not to leave the person alone until they are fully alert. The next video shows what a tonic-clonic seizure might look like and the appropriate way to respond. One thing to note, the video says to roll the person onto their side as the seizure is ending. The correct response is to roll the person on their side right away to keep the airways open, since the person will produce excess saliva.
Yeah, but no, I wasn't. I was playing video games. You were playing video games. Hun? Hun? Okay, all right. Okay. Hun, it's okay. Excuse me, ma'am. Can you please pass me my sweater and my bag over there? It's okay.
Sure,
Okay.
what happened?
It's okay. He has epilepsy.
Should I call 911?
No. Hun, it's okay. It's not an emergency. Hun,
Well,
it's okay.
Is he going to swallow his tongue? Are you supposed to put a spoon in his mouth or something?
Honestly, if we put anything in his mouth right now, he's gonna either choke or he's gonna break his teeth on it. The best thing we can do is just wait it out. We just gotta make sure he's safe and there's nothing around him where he can harm himself. on your side. Okay. 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 Just breathe. I'm here.
Absent seizures were formerly known as petit mal seizures. They commonly occur in children between the ages of 4 and 13. With this type of seizure, the person experiences an involuntary lapse of consciousness where they are psychologically absent. The seizure may be mistaken for daydreaming. The person does not experience an aura, and the seizures are very short, from 1 to 30 seconds in length, but the person could experience several hundred a day. To the person, it's like nothing happened. They will continue activities after the seizure that they were doing prior, and they will not remember the seizure. Absent seizures can generalize into tonic-clonic seizures. The following video shows what an absent seizure might look like.
We're supposed to take a lung sample, so just...
Okay,
No, no.
Don't worry about the alarm. We can win this. We only have 30 minutes to make the Christmas extreme cake. It's okay. Get the cake in the oven.
I need for you to carry out the directions.
Will you be there for me?
Of course I will. Do you have any questions?
Yes. What happens if the alarm goes off? Jen? Jen? Jen?
Oh, hold on a sec. I think she's having a seizure.
Is she okay? Should I go get the teacher?
No, this is normal. It's fine.
The object of this mission is to go as far into the Earth as possible. The alarm means nothing.
But if we go down any further, we will burn up.
Myoclonic seizures are characterized by sudden, brief, involuntary movements and jerking of the trunk and/or limbs that occur without warning. The person might fall to the ground as a result. Myoclonic seizures are difficult to predict and may be associated with severe intellectual and developmental disabilities. The following video shows what a myoclonic seizure might look like and the appropriate way to respond.
This video will show you how to help when someone is having a myoclonic seizure. During a myoclonic seizure, the person has sudden, short-lasting muscle jerks. Usually, just one or both arms jerk, but sometimes the person's head or whole body jerks. The jerking can be very mild, like a twitch, or it can be very forceful. Occasionally, severe myoclonic jerks in the legs can make the person fall and hurt themselves. Myoclonic seizures may happen as one isolated jerk, or they can happen in clusters. Myoclonic seizures are very brief, but can be extremely frustrating. For example, they can result in spilt drinks or injuries. The following scene shows you what a myoclonic seizure can look like.
That was a hard shift.
Oh yeah, really hard. Last week and worse. This week's just calmed down a little bit, hasn't it?
It has, yeah, definitely.
Just a bit tired at the moment, but I'm looking forward to next week.
Oh, how come?
Got a caravan booked on the coast.
Ah, so you got the week off then?
Yeah, really excited. Just a bit tired though, yeah.
Oh, You okay?
Yeah, I'm good, thanks.
Are you sure you're okay?
Yeah, I'm fine. Just a little seizure, that's all.
Right, well, don't worry about that. I'll go get that. As long as you're okay, yeah.
Oh, thanks.
So what have you got on this afternoon then?
Gotta go to cloakroom, get some stuff out and clear some out.
Yeah?
Yeah, what about you?
I'm back out on site.
Back on site?
Yeah, feeling sorry for me?
Just a little bit, yeah.
There's nothing you can do to help during a myoclonic seizure because they happen so quickly. Myoclonic seizures are very short and people recover immediately. You can help by offering assistance if anything needs clearing up after the seizure. Medical attention is only needed if the person has badly injured themselves during a seizure. Myoclonic seizures can be frustrating for the person as they can result in spilt drinks or injuries. You can help by arranging first aid if they've been injured or offering assistance with clearing away anything spilt during the seizure.
Atonic seizures are characterized by a sudden and brief inability to stand or sit upright. They're also known as dropping spells or minor motor seizures. They are most common in children and are difficult to predict. They occur with people who have some degree of developmental or intellectual disabilities. The person does not experience an aura, and the behavior consists of nodding of the head and slumping forward. The person may fall to the floor, so injury can be common. The seizures are brief but frequent, and the person has a momentary loss of consciousness, which can cause a person to be disoriented after the seizure. The following video shows what an atonic seizure might look like and the appropriate way to respond.
This video is about how to help if someone has an atonic seizure. Atonic seizures are also called drop attacks. During a seizure, the person loses all muscle tone and drops heavily to the floor. The seizure is very brief and the person is usually able to get up straight away. However, falls can result in injury, often to the face, nose or head.
Hi Sam, are you alright?
Yeah, I'm fine.
Do you need a hand with the leaflets?
No, but I'm gonna need some more envelopes quite soon, I think, because we're running out at the moment.
I'll go and... Sam, are you alright?
Yeah, I'm fine. Yeah, just the envelopes, I think, then we'd be...
Sam, is that another seizure?
Yeah, I'm fine.
Right,
Yeah.
I'll go and have a look for the envelopes. Do you want to go and get some fresh air?
Yeah, I'll take a break in a bit, but I'm fine.
I'll go and make you a cup of tea and look for the envelopes. I'm back in a second.
Yeah, thanks, that's brilliant.
Atonic seizures are very short, lasting a few seconds, and people recover straight away. There's nothing you can do during an atonic seizure because they happen so quickly. Because atonic seizures are short, afterwards people can usually carry on with what they were doing. If they've hurt themselves during the seizure, give them first aid or get medical attention if needed. You should only call an ambulance after an atonic seizure if the person is badly injured. Atonic seizures are very brief, and recovery is immediate. There's nothing you can do during an atonic seizure. Seek medical assistance only if the person is injured as a result of the seizure.
There are behaviors that are considered forms of seizure activity. Status epilepticus is a prolonged seizure state or series of seizures and is considered an emergency situation, which will be covered in more detail. Febrile seizures are not technically epilepsy and are frequent in childhood. They are convulsions caused by a fever and/or an infection. Children who have experienced febrile seizures are 3 to 6 more likely to eventually develop epilepsy than the general population. Infantile spasms are also not technically epilepsy, and they occur in infants between the ages of 3 to 8 months. They are commonly associated with intellectual and developmental disabilities. The behavior displayed is sudden stiffening of the body and brief bending forward or backward of the arms, legs, and head. As a staff member, you have important responsibilities when working with people we support who may experience seizures. Observation, documentation, and reporting are your responsibility and are extremely important in order to assist the medical provider with an accurate seizure diagnosis, as well as prescribing medications. Things to observe and document include what the person was doing prior to the seizure and whether or not they had an aura. This is to determine if there are any precipitating factors like stress, lighting, or anything else that might have caused the seizure. Additionally, observe and document what happened during the seizure. How did it begin and progress? In what parts of the body were there movement? What was the position of the body, the head, and the eyes? Did the person lose consciousness? Were they responsive? Did the person lose bowel or bladder control? Very important, how long did the seizure last? Did the person suffer from any injuries? What was the person's mental status following the seizure? Did they sleep? Were they confused? Did they have a headache? Could they speak or move after the seizure? Did they have any recollection of the seizure? As the videos showed, there are various ways we can assist people during and after a seizure. While some types of seizures only require observation and documentation on our part, tonic-clonic and complex partial seizures require more involved intervention. Status epilepticus also involves intervention and is considered a life-threatening event. When assisting with a tonic-clonic seizure, the greatest concern is injury to the head and extremities. Ways to assist with a tonic-clonic seizure include assisting the person to the floor if they are walking, standing, or sitting. Do not allow them to fall. Put something soft under their head. If the person is in a bed, do not try to remove them. Instead, place padding on the floor in case they fall out of bed, and also use pillows to provide a barrier to keep them from falling out of bed. Loosen tight clothing and remove glasses. As soon as you can, turn the person on their side to drain secretions and to keep the airways open. Place padding between the person and anything that can cause them injury as they are having convulsions. If breathing and jerking movements stop, begin CPR. Document in as much detail as possible what happened before, during, and after the seizure. Do not put anything in the person's mouth, try to restrain or control the seizure, or give the person anything to eat until they are fully alert. When assisting with a complex partial seizure, the greatest concern is protecting the person from harm. You can help the person by speaking calmly to them in a reassuring voice, following the person around until the seizure is done, guide them away from hazards, move any hazards out of their way, and stay with the person until they are completely alert. Although seizures are typically not considered emergencies, especially for people who have epilepsy or a history of seizure activity, there are instances when they can be considered emergencies. Emergency situations include status epilepticus, if the seizure occurs in water, if the person experiences respiratory or cardiac distress, if the person severely injures themselves during the seizure, if the person is diabetic, if a second seizure starts shortly after the first has ended, if there is no medical identification to show that the person has epilepsy, if the person is pregnant, or if consciousness does not return after the seizure has ended. If the person experiences status epilepticus, emergency medical attention should be obtained immediately. When medical providers work to effectively treat seizure activity, they are guided by the principles listed. They want to be sure they are identifying and diagnosing the correct classification of seizure activity and prescribing the most appropriate medications. They also want to be sure medication side effects are monitored and documented for the person, as well as ensuring the person and those that work closely with them are given information about the nature of epilepsy, their diagnosis, and how to correctly take any medications they are prescribed. We can assist with observing and documenting any medication side effects, as well as assisting people with medication administration. People we support may have more than one neurological problem, which makes seizure management more complex. The medical provider may need to prescribe multiple medications to acquire the perfect balance between the frequency of seizures and the person's activity level and alertness. The medications used to treat seizures control the frequency of seizures in one of three ways: through increasing the seizure threshold by decreasing the excitability of the brain cells. Medications used are mycilin and zerontin. Through limiting the spread of seizure discharge in the brain by slowing the electrical transmissions between nerve cells and the brain. Medications used are tegretol and dilantin. And through increasing the inhibitory pathway by controlling nerve cells through keeping them from firing too fast and overloading the system, which causes a seizure. Medications used are Depakote and gabapentin. When medications are taken orally, they travel through the body to do their job and are then excreted. Once the medications reach the stomach, they are absorbed into the bloodstream, where they travel to the brain and then ultimately to the liver and kidneys and then excreted. Because the medications travel to many areas of the body, many side effects are possible. Side effects of the stomach and intestines include nausea, vomiting, loss of appetite, difficulty swallowing, constipation, and diarrhea. Side effects of the skin include rashes, which need to be monitored closely, since they could be a sign of a serious allergic reaction. Side effects of the liver include yellowing of the skin and eyes, dark urine, light-colored stools, loss of appetite, and upset stomach. Side effects of the kidneys include swelling of the legs and frequent urination with possible burning. Side effects of the central nervous system include depression, drowsiness, and dilated pupils. Behavior side effects include hyperactivity, aggressiveness, hallucinations, excitement, and confusion. And a blood reaction side effect could be anemia. The objective of the medical provider is to reduce the seizure frequency, so it is very important to monitor and document any medication side effects. By using one or more appropriate medications, most people with epilepsy can be nearly or completely seizure-free. It is beneficial to know various terms associated with medications. Blood level refers to the amount of drug in a person's body. When taking a blood test for the blood level of a particular medicine, it should be done at trough level, which is right before the next dosing time for the medication. Half-life refers to the time it takes the individual's body to get rid of the medication in the body. Half-life is very individualized, and it is different from person to person. It is also different from medication to medication. For example, someone's half-life for one medication might be only a few hours, but for another medication, it might be 25 days. When a new medication is started, the blood level for that medication gradually increases until it stops increasing and levels off. That is steady state. Therapeutic range refers to the concentration of a medication in the blood that best controls seizures with the fewest side effects. Therapeutic range is the ultimate goal of the medical provider. If too much of a medication is prescribed, it could lead to side effects. If too few medications are prescribed, it could lead to seizure activity. The medical provider needs to find the exact balance to achieve therapeutic range. This is why observation and documentation are so important. The medical provider relies on observation and documentation to accurately diagnose and prescribe. Besides medications, there are other potential treatments for seizures. One is vagus nerve stimulation, which was approved by the FDA in 1997 and is used as an additional treatment for adults and adolescents who have partial seizures and are resistant to anti-epilepsy medications. With vagus nerve stimulation, a generator is implanted in the chest and delivers stimulation along a wire that runs to electrodes attached to the vagus nerve at the base of the neck. The stimulation of the nerve produces an effect in the brain that can reduce seizures. Additionally, a handheld magnet can be run over the generator to produce more stimulation. Various forms of surgery can also treat seizures. Typically, the surgery involves removing seizure-producing areas of the brain. A ketogenic diet can also be used to treat seizures in children. The ketogenic diet is high in fat and low in carbohydrates and can reduce seizures in children who do not respond to medical treatment. When medical providers treat seizures in women who are pregnant, the goal is to keep the woman seizure-free while limiting the effects of the medication on fetal development. It is important to regularly monitor blood levels throughout each stage of the pregnancy. Seizure activity changes vary greatly from woman to woman during pregnancy. There are some situations that are known to increase the risk of seizure activity in some people. They include various emotional factors, not staying on track with medication schedules, infections or fever, a woman's menstrual cycle, fatigue, low blood sugar, blinking light stimulation, outgrowing a medication dosage, hyperventilation, drugs and chemical interactions, hangovers, pregnancy, and caffeine. How can we avoid situations that increase the risk of seizure activity? We can help some people we support from feeling fatigued by helping them get enough sleep and to bed at a good time. We can also suggest naps to them if they seem tired. We can help with medication and chemical reactions by helping people to provide a list of all their medications to their medical provider and to help them learn which other drugs and chemicals may interact with their prescribed medications, such as alcohol or caffeine. There is no evidence that sexual excitement will cause a seizure. It's important to know that multiple medications can cause a low sex drive and that some medications can decrease birth control pill effectiveness. For women who are planning to get pregnant, they should consult their doctor for guidance beforehand. When working with pregnant women with epilepsy, the goal of the medical provider is to help the woman be seizure-free while limiting the effects of the medications on fetal development. We want to be sure we help people we support who may have epilepsy with employment. If we feel a person we support is being discriminated against at their workplace because they have epilepsy or seizure activity, we need to advocate for the person. Getting and keeping a job does not depend as much on seizure control as on being qualified for the job. The decision on whether or not to hire a person should be based solely on the person's qualifications and not the fact that they have epilepsy. We can help the people we support by educating their employers and coworkers about epilepsy. We can also help the person prepare for medication side effects and potential rejection from coworkers. In any case, we need to help the people we support to understand their legal rights. We may find that people we support have difficulties staying on task with their medication schedule. When a prescribed medication schedule is not followed, seizure activity can occur. Some ways we can assist people we support with staying on task include using a divided pill box with doses for each day of the week, using an alarm clock or watch, using a pill box with an alarm, putting notes around the home, using a wall calendar or any type of calendar to show when medications should be taken, using a day planner, and using a picture timeline. Some health strategies we can help people we support with adopting include getting enough sleep, eating a healthy diet, adhering to their medication schedule, using alcohol with caution, and keeping active and fit. These health strategies can help reduce the frequency of seizure activity. We can also help boost the emotional well-being for people we support in many ways. We can help them not be afraid of going out because of concerns that they may have a seizure, by encouraging them to wear any medical ID jewelry that they may have, through helping the person stay busy and active, and to remember all of the things they can do. Allow them to do as much for themselves as possible, which is active support, by helping the person ignore any negative reactions from others, and helping the person to remember all of the things they have to offer and that they have as much of a right to a happy life as anyone else. Thank you for joining the Seizures class. When you are ready, you can sign up for a time to take the test. If you have any questions or need additional assistance, please email the training department at rrhsftraining@rrhsf.org. Thank you so much.